Hi, my name is Alvina Rochets, and I'll be doing my presentation on Atropa Belladonna. So the situation we're going to be going over is in the film The Little Hours, which can be found on Netflix. One of the main characters, Fernanda, brings up to the group about using a potion that has belladonna in order to seduce men. Later in the film, Fernanda and her friend are seen boiling the belladonna, and her friend strictly states the importance of not ingesting it. She doesn't specifically specify why, however, later in the film, we see what happens. Um, so her friend places a drop in each of Fernanda's eyes, and it is later seen that her eyes are greatly dilated. Ginevra, one of the girls in the group, gets jealous and boils her own pot of belladonna. However, she takes a sip of it from a wooden spoon, unknown of the true route of administration. She starts acting erratically, hallucinates what she sees and hears, and eventually is coughing, nauseous, feverish, and is dehydrated. In this presentation, it will be discussed whether if Ginevra ingested enough Atropa belladonna to experience her symptoms or whether if it was exaggerated. So before going over the pharmacokinetics and the pharmacodynamics, I wanted to discuss the origin of Atropa belladonna, which is also known as deadly nightshade. It originates from southern Europe and Asia, and Venetian women would use the plant in a diluted form as eye drops to dilate their pupils to enhance their beauty and for seduction purposes. It has also been used for medicinal purposes at low doses and as weapons by poisoning. Atropa belladonna is composed of three alkaloids, atropine, hyoscyamine, and scopolamine. All parts of the plant, so the stem, the leaves, and the berries, are highly toxic. Atropine is still used today by ophthalmologists for eye examinations as an antidote for opium and chloroform poisoning and in lotions to relieve pain. Hyoscyamine today is used for relieving gastrointestinal disorder symptoms, and scopolamine is used as an anesthetic for treating irritable bowel syndrome and for treating motion sickness. In figure 1, we have the Atropa belladonna plant. Um, as you can see, the flowers and the berries have this bright purple shade to them that are very enticing for their victims. These are the three different types of structures for the alkaloids. Figure 2 has the chemical structure of atropine, Figure 3 has the chemical structure of hyoscyamine, and Figure 4 has the chemical structure of scopolamine. As you can see that these structures are fairly similar, they're derivatives of each other, and the scopolamine has the epoxide here on the chair conformation. Also, when observing the log P and the structure of each of the compounds, it can be seen that they are highly lipophilic. The route of administration for each of the alkaloids are fairly similar. Each of them can be administered orally, intravenously, intramuscularly, and subcutaneously. Atropine can also be administered ocularly and endotracheally. Hyoscyamine can be administered sublingually, and scopolamine can be administered transdermally, percutaneously, and topically. For the distribution of the alkaloids, all alkaloids are absorbed in the GI tract after oral administration. It enters the circulatory system and crosses the blood-brain barrier where it causes the central nervous system effects. For atropine, the intramuscular administration is rapidly absorbed, enters the blood, and distributed to the body's tissues and fluids, and it has a volume of distribution of 1 to 6 liters per kilogram. Hyoscyamine is distributed throughout the body and crosses the blood-brain barrier and has a volume of distribution of 1.01 liters per kilogram. Scopolamine is the same, it's absorbed in the gastrointestinal tract, enters the bloodstream and then crosses the blood-brain barrier. And it has a volume of distribution of about 1.4 liters per kilogram. For the metabolization of the alkaloids, after oral administration, they are metabolized in the liver and undergo enzymatic hydrolysis through hepatic oxidation and conjugation into parent and inactive metabolites. And they undergo first-pass metabolism, and scopolamine is metabolized by cytochrome P3A. Looking at figure 5 here, shows atropine's metabolism as it undergoes and turns into tropine, and then eventually becomes succinate and acetone and phenylacetate. For the elimination of the alkaloids, atropine has 13 to 50% excreted in the urine and has a half-life of 3 hours. Hyoscyamine is eliminated through the urine and has a half-life of 2 to 3.5 hours. And scopolamine from oral administration is excreted in the urine, and less than 10% of the total dose is excreted and has a half-life of 4.5 hours. For the mechanism of action for the alkaloids, all the alkaloids are competitive antagonists that bind and inhibit the muscarinic acetylcholine receptors, and they block acetylcholine from binding. This interferes with the transmission of nerve impulses in the parasympathetic nervous system, so that includes the bronchial, sweat, salivary glands, and the eyes, heart, and gastrointestinal tract. In figure 6, it can be seen how scopolamine and atropine, as well as hyoscyamine, we can just imagine it there, are competitively binding to the muscarinic receptor and not allowing acetylcholine from binding. When going over the toxicity, Atropa belladonna has an oral overdose level of 600 milligrams. Atropine has a low toxic dose for humans through oral administration that is 0.33 milligrams per kilograms, and they also have reported a low lethal dose of a man with a unreported route of administration of 0.143 milligrams per kilograms. The overdose symptoms cause paralysis of the parasympathetic organs, dry mucous membranes, dilated pupils, tachycardia, fever, cutaneous flush, and mental and neurological symptoms. In severe cases, there can be respiratory depression, coma, circulatory collapse, and death. For hyoscyamine, an unreported route of administration of a low lethal dose of a man was recorded as 1.471 milligrams per kilograms. The overdose symptoms of hyoscyamine include headache, nausea, vomiting, dilated pupils, hot, dry skin, blurred vision, dizziness, dryness of the mouth, difficulty with swallowing, and central nervous system stimulation. For scopolamine, there is no reported lethal dose or toxic dose for oral routes of administration for humans. However, the LD50 for a mouse through oral administration is 1,275 milligrams per kilograms, and the overdose symptoms include fever, warmth, vomiting, restlessness or excitement, confusion, hallucinations, shallow breathing, or seizures. So in the film, in the beginning of the film, when Atropa belladonna was used in order to dilate Fernanda's eyes, she diluted it prior to using it, which corresponds to studies showing that the plant needs to be diluted in order to use the therapeutic effects of the plant. I really like the cinematography of the film because they made sure to show a close-up of her face, and we could clearly see that her eyes were very well dilated. Atropine is one of the key alkaloids in the plant and is still used therapeutically for eye dilations by ophthalmologists. So the matter still is, did Ginevra ingest enough Atropa belladonna to experience the effect she had? It is unknown how much she had, however, she had a sip from a wooden tablespoon, so we can assume she ingested a tablespoon's worth, which is 15 milligrams. The actress that plays Ginevra is Kate Micucci, and she is said to be 5'2" and is fairly skinny, so we can set her weight based on BMI at a normal range. So we can assume that she weighs 120 pounds, which is 54.48 kilograms. So based on her body weight and how much she consumed, based on our assumptions, she consumed 0.28 milligrams per kilograms of Atropa belladonna. So in comparison to the known toxicity dose for humans in oral routes, she did not consume the toxic dose. However, she is fairly close to it. After her ingestion, Ginevra's reaction does align with the overdose symptoms of each of the alkaloids in several ways. She had cutaneous flushing of her face and dilated pupils from atropine. She experienced nausea, blurred vision, and dryness in the mouth from hyoscyamine, and almost all the symptoms of scopolamine except for shallow breathing and seizures. So in conclusion, the little hours showed an accurate representation of the proper use of Atropa belladonna, as well as the reaction to improperly using it. Based on our assumed calculations, Ginevra was lucky enough to not consume the toxic dose of ingesting the plant. However, she did consume enough to experience the overdose symptoms of each of the key alkaloids presented in the plant. The alkaloids are highly lipophilic and easily cross the blood-brain barrier to induce her hallucinogenic symptoms and affect her parasympathetic nervous system. Because the alkaloids bind at the muscarinic receptors and block acetylcholine, and that highly explains the symptoms that she experienced. So thank you. And here are my references as well.